Hi guys. So here's my thought. I'm a little concerned about Chapter 7 and how it's going to fit into our schedule. So I'm going to do a voiceover for you guys with this to make sure that everybody gets the information that they need, especially with our test next week, okay? So Chapter 7 talks about ethics and how it relates to the nursing practice. So some general kind of types of ethics and terms related to ethics. Meta-ethics is very high level, right? It's way up here somewhere. It focuses on universal truths, and it's really where ethical principles are developed. Normative ethics focuses on moral standards that regulate behaviors, and applied ethics. So those ethical beliefs and those types of ideals that we apply to certain situations. It talks about here we talk about euthanasia, capital punishment, abortion, healthcare disparities, and in this day and age, I'd be willing to bet that that there could be some ethical issues related to COVID, right? Something we've certainly been dealing with for the last year and a half, couple of years at this point. It sure does feel like, doesn't it? So I would kind of lump that into the applied ethics idea as well too. Some basic concepts of ethics. So values are those attitudes, those ideals, those beliefs that you as an individual hold, and that helps guide your behavior. It kind of tells you right versus wrong, what's important, what things are important over others, or what appropriate behavior you may have in certain situations. I think of values and I think about those things that you grew up with, right? You learn right versus wrong from your parents, probably to begin with, and what appropriate behavior would be in certain settings and those types of things. And those values were instilled in you by your family and by your upbringing, by other people that had some influence over that in you. Morals are those things that provide a standard of behavior that guides what we do. There's certain rules of conduct that are used in situations where a decision about right and wrong must be made. And what I think that, potentially what we've seen, and again, I'll pick on COVID a little bit, right? We know that, where people make decisions about right versus wrong is people have different ideas of that, right? And a lot of that time that is based on their values, those things that they value that guides their morals. And then finally, ethics are those, actions that a person should take or that might be codified is in the ethical code of a profession. We think about nursing. We have ethics in nursing that we kind of follow, and that kind of guides what we do. Ethical behavior. These are the right things to do. These are the wrong things to do. We've had some examples of that in class, and I think that that we've also seen where we talk about the Nurse Practice Act and a lot of those things, or ethical practices in nursing that are written down. We've talked about that before. Sorry. So bioethics specifically, they're ethical theories and principles that relate to moral issues or problems in healthcare. The ANA position is that code of ethics for nurses is non-negotiable, and each nurse has an obligation to uphold and adhere to the code of ethics. So nursing, the ANA, the American Nurses Association, has a position statement that talks about this code of ethics that all nurses should live by within the profession. And we have an obligation to the people that we care for to uphold and adhere to that code of ethics, right? And I'm going to mention this, and I've bolded this in this slide, and I'm going to mention this here, and I'm going to mention it kind of later as well too. Everybody needs to really carefully consider their own values and morals on deciding where to work. This will help you decide what environments you want to work in, what client populations you want to treat, and who you're best, who it's best to work with. I think of, and I'll use this as an example, I think that a lot of people have certain feelings, values, and morals related to abortion. In the hometown that I'm from, there was two hospital systems. One was a Catholic hospital system, and one was a public hospital system, right? And if you were considering working in either of those facilities, you may consider, that type of an issue. What are your values and morals based upon your feelings about abortion? Obviously, the Catholic hospital did not perform them. So if you felt that strongly and those were your values and morals, you may tend to work in that environment. versus if maybe you looked at it in a different way. You may work at the public hospital. If you didn't have a feeling either way, that would probably have a bearing on where you work. But I kind of talk about that situation. But we know that there are other ethical and moral issues out there that nurses really need to consider. What are their values? And don't put yourself into a position where it's going to be uncomfortable or more than uncomfortable when you go to work if you have a certain client population that may not have the same values and morals that you do. So we talk about this idea of moral distress. And I'm kind of glad that we're talking about this more in healthcare these days. Part of my research for my PhD is actually talks about moral distress. And the idea here is where you know the right thing to do, but because of some reason you're unable to do it. You may have internal constraints, so there's lack of moral courage. And you will all find a voice as a nurse as you come into the nursing profession, as you get comfortable in the areas you're working in, as you get comfortable with the people that you're working with. You'll find that your voice when it comes time to advocate for a patient, and your level of moral courage will increase. Another way that we may experience moral distress is there may be external constraints, right? Maybe there's an institutional policy that kind of flies in the face of what you hold dear. And this goes back to making sure that wherever you're working somewhere where the morals and the values kind of map to where you're at with that line of thinking, right? Or there may be power differentials. Think about doctors, practitioners, right? Where you as a nurse know the right thing to do, but that may not be in line with what the practitioners want to do. And that can lead to healthcare quality issues, job satisfaction, physical, emotional well-being of the nurse. So I go back to you're working in an environment where your morals don't match those that you're working with, or procedures that they might be doing or something like that, right? That's going to impact your job satisfaction. That's going to impact your emotional and physical well-being. I can think of, as an example, I can think of situations where a person will come in cardiac arrest. And you as a nurse, and you will learn this, that despite all of our efforts, we may not be able to save the patient, right? It unfortunately happens. But in that case, you may be working with a practitioner, or you may be working with family that want you to continue the efforts, right? We want to make sure we do they want you to do everything for this patient to help them survive, where you know that everything that you're doing isn't going to make a difference. So you end up with this moral argument in your head, like, I'm getting orders from the doctor, so I need to keep doing what I'm doing, but at the same time, I know what the outcome is going to be. Or the family, they're this patient's healthcare proxy, and they are impressing upon us to continue to do what we're doing in order to save this person's life, when we know what the end result's going to be. So that might cause this conflict in yourself and be morally distressing. And if you come upon enough of those situations, right, that could lead to decreased job satisfaction, that could lead to physical and emotional distress, those types of things. There's a couple of theorist philosophers that your textbook talks about. Kohlberg is the first one. So Kohlberg came up with these stages of moral reasoning, and this is what he was thinking was, at different stages in our life, we're going to look at moral decisions and moral situations, and we're going to react to them differently. So he came up with 3 stages. He came up with this pre-conventional stage where somebody responds to a moral issue, irregardless. They're not even considering what the social norm is. Then there's a conventional level where moral decisions conform expectations of a family, a group, or a society. Now, a negative example of this would be, you've got kids that just want to be accepted, and you've got peer pressure there. So they make their moral decisions based upon wanting to conform to that group. And then that post-conventional level is where people have the ability to define their own moral values because they've been developed through the other stages. So you guys, I think, you're kind of at a point in your life now where you're at that post-conventional level, right? You can define your own moral values based upon what you've learned and what you've experienced and what you value at this point in your life. You're not making moral decisions, for the most part, to conform to any family or group, right? You're making these decisions on your own based on your experience. Kohlberg said that all the stages are sequential, and certain conditions might stimulate higher levels of moral development, right? So people may move through these stages quicker, dependent on intellectual levels, dependent on an environment that may force them into moving through those moral reasoning stages, or if there's conflict within themselves, right? If they're in that conventional level where they're trying to conform to a group, but at the same time they realize that something's just not right here, right? In those cases, they may be able to define their own moral values, irregardless of what the group around them is coming up with, and that would move them quicker into that post-conventional level. Gilligan, she was a student of Kohlberg's, but her concern was this: when Kohlberg did when he did his research, when he came up with those stages, he only used men in his research. There were no women that were involved. She felt, and I would agree with her, that women's moral reasoning is shaped differently, right? And she felt also that the moral person is one who responds to the needs of others and demonstrates consideration of care and responsibility in relationships. Kind of sounds like nurses, doesn't it? Kohlberg felt that morality was based upon justice, upon doing the right thing, about right from wrong. Everything was it was very cut and dry, right? Whereas as Gilligan said, well, you know what, that's all fine and well, but more importantly, that moral person needs to respond to others and consider others and take care of relationships and those types of things. Her levels of moral development kind of mirror his, but a lot of hers were started out with orientation to individual survival. And then that kind of moved on to focusing on the goodness with recognition of self-sacrifice. So meaning, somebody morally did something good and understood at the same time that they were making a self-sacrifice in doing so. And then they reached this next stage where they realized that caring and being responsible for others was a moral right, as was taking care of themselves. So as we can see, nursing's focus is consistent with Gilligan's theory when you think about what we do as nurses and how we care for people. But there are times where we may need to take both of these, Gilligan and Kohlberg, and mesh them together when we have to make ethical decisions, right? Sometimes we need to lean towards what's caring and responsible for others, and other times it's just a matter of really doing what's right and that justice. So we're going to go through some theories of ethics here. Deontology talks about the fact that an act was moral if its motives or intentions were good, regardless of the outcome. So you do something and your motivation was good, but there's a negative outcome. Deontologists say you're cool because you did it because your intentions were good. If somebody talks about an act deontologist, that's determined the right thing to do by gathering all the facts and then making the decision, right? We pull all the facts in, we make that decision, we act on it. Rule deontologists emphasize that principles guide our actions. They're kind of rule followers, right? Always keep a promise, never tell a lie, those types of things. Utilitarianism, the moral rightness of an action is determined solely by its consequence and the greatest good for the benefit, happiness, or pleasure of the greatest number of people. And I don't know, are there any Star Trek fans out there? I mentioned this in one of the classes. If you're a Star Trek fan and you watch Star Trek II, Wrath of Khan, at the end of that movie, one of my most favorite lines in that movie is that the good of the many outweighs the good of the few or the good of the one. And that's really what this is going for, right? You see a bullet point there that talks about triage. So where sick and injured are classified by severity to determine priority. Where I think about this is, obviously, you guys know I worked pre-hospitally. I worked on fire departments and ambulances, and I worked in the emergency department. We did a lot of training on mass casualty incidents. And in a mass casualty incident, you can have a great number of people that are injured that need to be cared for with a very small number of responders. So we would always run drills, and you'd have a bus accident where you've got 50 people on a bus, but you only have 5 responders at first, and it's going to be a while before anybody else gets there. So those 5 responders have to go and look at those 50 people and do the greatest benefit for the most people. And a lot of times that's kind of difficult, right? We would go through, we would run drills, and we would triage, we would assess a patient very quickly. And if they were seriously injured, but there was something that we could do right then and right there to help them, then we would help them. Unfortunately, sometimes in situations like that, though, too, we would triage a patient, and if they were severely injured and there wasn't anything that we could do for them, we would move on to the next patient. I'm very thankful that I never ran into a situation like that in real life. We only had to do it in training. But I think that could be very difficult. Those could be difficult decisions to have to make. But the idea of this, within this utilitarianism theory of ethics, is the fact that you have to do the greatest good for the most number of people because you have limited resources. Another example of this is healthcare dollars and research. There's only so much money to go around for healthcare research. So I think that's why a lot of times you see that money will go to research a certain healthcare condition over others, because a great number of the population may suffer from cancer, so a lot of money goes to cancer research. But if you have a very rare disease or something like that, that may not get an equal amount of money because it doesn't impact a larger part of society. And unfortunately, that's, you guys, if we were in class talking about this, I'm sure you could give me some examples, but that happens, right? There's only so much money to go around, and the money goes to where we can do the greatest good a lot of the time. Virtue ethics, it emphasizes the character of the decision maker. Virtues are those things that, how we act, feel, or judge that develop through training, but also come from natural tendencies, those gut feelings. And the thought here is that individuals' actions are built from a degree of inborn moral virtue. So people have within them, this kind of innate moral virtue, and their actions are based upon that. And this may separate this may be what separates a competent nurse from an exemplary nurse. So a nurse that does a good job versus one that goes over and above. Principalism. I like these. I really like these because on the next slide we'll see Florence Nightingale's, in her pledge for nursing, talks an awful lot about these. And I think that as nurses, we utilize many, many of these in almost every action that we have every day. So there's beneficence I'm going to go with beneficence. That's to do good. So every time that we go to work, we want to make sure that we do good. Also, there's non-malfeasance and do no harm. So we don't want to harm our patients. And, every situation that we're presented with as nurses, we have the opportunity to practice beneficence as well as non-malfeasance. Autonomy is a respect for a person's ability to act in their own best interests. And I've talked about this before, but sometimes that kind of flies in the face of what we think their best interests are. But we need to remember that we're there to treat our patients and advocate for them, but it is ultimately their decision on their care. The Jehovah's Witness I've talked about in class, my best interest would have been give them blood, right? That person that was in the car accident, they needed a blood transfusion because their blood levels were low. In my mind, they needed that blood transfusion, but their beliefs, their values, their religion did not allow that. So, and I gave them the autonomy, right, to make that decision on their own. The idea of justice is that equals should be treated the same. Clients with the same healthcare needs or diagnosis should receive the same care. Again, unfortunately, there are many factors that kind of feed into justice in our healthcare system, right? I think we talk about, hopefully we can talk about it, and maybe you talk about it in a later class, we talk about healthcare disparities, where you have patients clients that have the same condition across the board, but depending on demographics, depending on socioeconomic background, depending on the resources that are available to them right in front of them, there may not be justice. Where I came from in upstate New York, we weren't exactly a rural area, but there were rural areas around us, and there's a hospital in Cooperstown. Hopefully, you guys know where or have heard of Cooperstown. Very small area, but a patient in Cooperstown at that hospital with a certain condition, and a patient in New York City with the same condition may not have that same healthcare. They may not have access to the same level of healthcare. In that case, just based on demographics, or I'm sorry, on geography, not demographics, on geography, on where they were. Fidelity is faithfulness in honoring commitments and promises. Don't ever tell your patient that you're going to do something for them and then not do it. I mean, something as simple as, I'll be back in 20 minutes to give you a bed bath. They expect that, right? And then veracity, truth telling and not lying. So for nurses, this can sometimes present as a difficult part theory of ethics, difficult part of principlism. When you know what potentially is going to happen to a patient, say that they have a terminal diagnosis, but the patient hasn't been told. But maybe they kind of have that sixth sense, and they ask you, is this going to happen? Am I going to die? And this one might be difficult, right? Do you tell the truth in that case? Do you not lie to your patient in that case? How do you frame that conversation? So this one can be a difficult one for nurses some of the time. So this code of ethics, a code of ethics is that social contract through which our profession informs society. These are the principles and rules by which we will function. This is what we hold as important as nurses. And this is how we're going to treat you as a society, as an individual client. It helps us shape our self-regulation. Remember, nursing is self-regulated, right? That falls within those definitions of professionalism, of a profession versus an occupation. And it also helps serve as a guideline to the members of our profession. We all as nurses can look at that code of ethics and say, okay, this is the benchmark by which we're going to be judged. That Florence Nightingale pledge, I mentioned that again. There's components of principlism are found throughout that, so I really like that. And then finally, there's a code of ethics for nurses with interpretive statements that's published by the American Nurses Association. And that's our profession saying these are our values, these are our ethics, and this is our duty to you as the public. Those interpretive statements help us as nurses and help the public also kind of understand what we're getting at when we talk about the different facets of that code of ethics. So how do you make ethical decisions? Well, your textbook gives you this kind of step-by-step process. Clarify what that dilemma is. Gather additional data. What else do I need to know to make an informed decision about this ethical dilemma I have in front of me? Come up with the options, figure out what maybe potentially the best decision is, act on that decision, and then evaluate, right? Did I do a good job of understanding what the ethical dilemma was? Did I put a good plan into place? And on acting on that, did it work? So dilemmas resulting from personal value systems. And this goes back to that I bolded it down at the bottom there, right? So those values are learned beliefs that help us choose among difficult alternatives, even when there may not be a good choice, right? I'll go back to Star Trek again. You guys are going to think I'm a nerd. If you didn't know it already, now you do, right? But they talk about the Kobayashi Maru. It's a test that they give people in cadet school, and it's a no-win situation. But sometimes, those values help us figure out, even in a no-win situation, what's the best choice. And we also need to remember that professional ethics, those ethics, the code of ethics that the nursing profession puts out there, outweighs our personal ethics in a professional setting. When you go to work, you need to leave your personal ethics at the door, right? It's not about you, it's about the patients you're caring for, and it's about the ethics that our profession has put forth. That's why, and I'll say it again, it's up to you to find a work situation where your personal ethics are not routinely challenged by clients and situations. Make sure that your ethics match with the place that you're working, and you will never have to deal, hopefully you won't have to deal with many dilemmas resulting from that conflict between your personal value system and your professional value system. Dilemmas involving other people and other professionals. Obviously, you know that we all participate as members of the healthcare team. It involves that cooperating and collaborating with others. And there can be conflicts in stressful situations. I've certainly been in, I worked in ICU and I worked in the ER. So, I was in many, many stressful situations. And there were times where there were conflicts among the healthcare team in what we thought was best for what was going on with the patient. Remembering at the end of the day, it really is that autonomy in the patient that was preeminent. That was the prime thing. But there were still some conflicts in stressful situations about what we should do, or if we should keep doing what we were doing, right? Going back to that moral distress. Instances that might cause those ethical dilemmas are providers who fail to meet standards of care routinely. You're working with that one person that they just don't do their job well. That could cause conflict. Incompetence, somebody that just, not only do they not meet the standard of care routinely, but they're just not good at their job, right? And actions that are considered unethical by other professionals. We've talked about, in Chapter 6, we talked about drug and alcohol use and being under the influence in the workplace. That could in it itself cause an ethical dilemma, right? You're the professional, you know it's the wrong thing to do, but at the same time, you've got a coworker that's using drugs on the job. And the ethical dilemma in that is, do you not say anything, or do you say something? Do you go to the supervisor? What do you do in that case? And it goes back to, what are your ethics? What are your values in those situations? And I think everybody may have a different answer to something like that. Dilemmas regarding patients' rights. So we talked about this Patient Self-Determination Act in Chapter 6. That is in place to safeguard our patients and their rights. Patients are given the legal right to demonstrate how vigorously they want to be treated in life and death situations. That's those advanced directives. That's when you have the patient, the person write down this, if I'm in this situation, this is what I want. If I stop breathing, I do or I don't want a breathing tube. If my heart stops, I do or I don't want you to try and save my life. And that third bullet point there can be difficult at times, difficult for staff, difficult for family, right? But hospitals, we have to go by what those advanced directives are. If you have an advanced directive that says that the person wrote and they're of sound mind, and they were competent when they wrote it and when they signed it, and it says, if my heart stops and I stop breathing, just let me go, then you as a practitioner, you as a hospital, you as a nurse have to abide by that. Even if there's family there telling you to do otherwise, even if there's physicians there telling you to do otherwise, we have to go by that client's wishes. We have to tell patients about advanced directive laws. So when patients come into the facility, we're always screening them. Do you have advanced directives? And if they don't, we actually had pamphlets at the triage desk in the emergency department. I would pass them out to patients when they came in. This is what an advanced directive is. This is why they're important. And there was actually part in there that they could fill out right in that pamphlet. So we need to document what those advanced directives are in the patient's record. When you guys are in clinical with me, one of the things that I always ask my students is, what's your patient's advanced directives? Do they have them? What are they? Because, and I know I've said this before, but it bears repeating, you need to know a patient's advanced directives before you need to know it. The beginning of the shift, when you look at a chart, that's when you need to know it. When your patient stops breathing or when their heart stops is not the time to try and figure out what their advanced directives are. You should have already known that. And then finally, within that act, it's educating staff and community about what advanced directives are. Oops, sorry, I'm a little too fast there. So what do those advanced directives do? They assure autonomy. Remember what autonomy is. It's that giving that patient the ability to make decisions on their own, if they have the capacity to do so. They can refuse medical interventions, and it's death with dignity. There are people, when they come to the end of their life, when they stop breathing, when their heart stops, they don't want a lot of that extra stuff. They don't want CPR done on them. They don't want the tube in their throat. They don't want to be the electric shocks, those types of things. They just want to die with dignity. and we should afford that to our patients if that's what they want. So in a nutshell, it really is, it indicates individuals' wishes regarding the end-of-life issues before they get to that point. And we should encourage all of our patients, if they don't have them, to talk about their advance directives with families or others responsible. And if they do have them, make sure that family members or others responsible for them know where those advance directives are and know what their wishes are. Ethical issues related to immigration and migration. So we know that there can be issues, and this goes back to talking about cultural awareness at the very least, if not cultural competency, right? There are problems, we may see problems between problems. Wow, that's redundant. We may see problems between patients and healthcare providers because there's a language barrier there. Many nurses are not bilingual or fluent in medical technology, and they should defer to a professional medical interpreter for explanations of complex healthcare related issues. Point here being is this, maybe you've taken 7 years of Spanish, so you have a decent working knowledge of Spanish and communication, but there may be parts of that, of taking that language where you haven't talked about medical terminology in another language where you can confidently and competently discuss procedures with your patients. In those cases, you really should have a professional medical interpreter to talk through and to interpret for you. The hospital that I worked at, we actually had, we purchased iPads that we could roll into the patient's rooms, and they would select the language, and it would actually bring up FaceTime, and they would FaceTime with somebody, and you would be in the room as well too, and you could FaceTime with an interpreter, so that you knew, and it was a medical interpreter, so you knew that that what was being discussed and relayed to the patient was accurate. Another one of the problems is the fact of migration of nurses. So we have these shortages of nurses in other countries, and we have nurses coming from one country to another. And again, there may be communication or language problems, just if they don't understand the language fully. And also, there might be a problem with documentation to provide safe nursing care. In other words, if somebody speaks English as a second language and they're trying to chart something, or even looking at the medical terms, they may not fully understand what those medical terms are or what they need to chart. Dilemmas created by institutional and social issues. So you may have dilemmas that occur between nurses and organizations because of policies or that they may come up with, or mandated by governmental agencies. And I'm not going to fully go there, but there are government entities now that are mandating that healthcare providers have vaccinations, and that could create an ethical dilemma between nurses that are employed and their beliefs and their values, and the policies and procedures that are being set down. In some institutions, there are actually ethics committees that may help look at some of these issues and come up with ideas to help nurses work through them. Dilemmas created by patient data access issues. We need to remember that, and we've talked about this in Chapter 6, right? Access to healthcare information comes with a great responsibility, and we need to protect that information from unauthorized use. It goes back to, if it's not your patient and you're not taking care of them, you should never ever be in their chart. There's absolutely no reason for that whatsoever. I'm pretty sure I stressed that pretty good in class, and I'm just going to say it again. And we know that computer ethics has been in existence since the 70s, because computers on a personal level have really been around since the 70s, right? But really what it comes down to is that we need to protect information in the healthcare setting from those that shouldn't be looking at it. Wow, that's it. Okay. So if you have any questions at the end of all of this, please let me know. Other than that, I hope you guys have a good rest of your day, your night, or whenever you're watching this. So I'll see you guys soon.